Welcome to this video of me performing bilateral partial nail avulsions for ingrown toenails to both big toes. The patient is already anaesthetised with local anaesthetic digital block, so the big toes are numb and the rest of the foot has full feeling. These are pretty bad involuted big toenails, and so we are going to remove the two sides, as you can see here. They're also very, very thick nails and need quite a bit of force to cut them. Once these are healed though, the nail should look much like it did from an aesthetic point of view, but without the involuted corners. Always believe we should remove as little of the nails with a partial nail avulsion as possible, but these two pieces are quite large given how involuted the nail was. We're using a tourniquet here to prevent bleeding when we are performing a phenol nail bed ablation, so this is what I'm doing now. We add a chemical called phenol, which stops the nail from regrowing in those two corners. That if there's any bleeding, this process is very unlikely to work. We know this procedure is something between 90 and 97% successful. And on the occasion that we do get a nail regrowth, the procedure can be performed a second time. So phenolization is complete and we remove the toe tourniquet. Should always make sure circulation has returned before we put the dressing on, and you can see the toe has turned pink and has started to bleed. I'm using a counterstacked dressing immediately against the toe, and this helps prevent post-operative bleeding, which is one of the main complications to be concerned about. The other main consideration post-operatively is that your wound can get infected. We counter this risk as ingrowing toenail left is likely also to get infected, and very often we see these after several bouts of antibiotics. I'm applying a compression bandage to the toe. I always advise the patient to remove this compression bandage if they have any significant pain, which is usually at night. I probably only had 1 or 2 cases of this in the last year. Most are comfortable with this bandage, and so far with this technique I have had no patient bleed through. And we move on to the left foot. Procedure is performed in outpatients, but with all sterile drapes and sterile instruments. And again, we separate the nail to be removed from the nail bed. I'm a big believer that this is done quickly and with minimal fuss. I believe this helps healing post-operatively. You usually have very little trouble cutting these nails, but these are particularly thickened toenails and are more difficult than average. Again, we clip onto the nail, twist out the piece. It's a fairly large bit. We want to make sure we've removed all of the nail. And that's why I'm checking here. As there is a small piece left in the nail bed, and that's I've had to take out in a second attempt. Sometimes the nail breaks and this happens, and it's important to make sure we leave no nail under the sulci, as that will prevent the phenolization from working, and we will have almost certain nail regrowth. These phenol applicators come ready to use. We're looking for the tissue down the sulci to turn completely grey, so we're looking to make sure there's no pink tissue. I think it's be careful not to over-phenolize these, as that also delays healing. This is, after all, a chemical burn. Once we've effected the tissue change we're looking for, procedure is complete. This nail is also very long. It'd be uncomfortable to wrap up with a compression bandage, so removing the tip is not a bad idea sometimes. Again, wait till circulation returns and begin the same dressing technique as seen on the other side. Each patient goes away with written guidance and my contact details should they need help after their appointment is finished. And patients are advised that should they have a medical emergency, they should present to their emergency room. And that, fortunately, is a very rare occurrence. And thank you for watching.